Hello everyone, a very good morning to all of you. I hope I'm clearly visible and audible. Let me confirm if I'm clearly visible, audible. If I'm live, I will go ahead. I will start the lecture ahead. Give me a minute. Just a second. So yeah, I hope it's working. So a very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I'm here to continue my series that is super simplified pathology. So in this series, I am going to cover entire pathology. That is, I'm going to decode the entire Robbins in a super simplified manner. So without wasting time, I'm coming on the topic. So today I'm going to teach you a very important topic from general pathology, that is hemodynamics. In hemodynamics, we already know, yesterday I have started hemodynamics. So I have given you a list of these important topics which are very important for hemodynamics. From exam point of view, from a university exam point of view for second prof MBBS students, as well as all competitive exams, that is NEET PG, FMG or INI-CT. This hemodynamics topic is very important. You get a long question as well as short question in your university exam from this, and even you get many MCQs in your exam, competitive exam, from hemodynamics. Now these all important topics are there in your syllabus that you have to cover for your exams. So yesterday we have already covered edema. We have covered everything about edema. Those who have missed edema, they must watch the recording of edema. It is available on the YouTube, right? The second topic is hyperemia and congestion, which I am going to take after this. Currently, I am teaching you thrombosis and embolism. So this is a lecture in which I am going to teach you thrombosis and embolism. But I cannot teach you directly thrombosis and embolism. For understanding thrombosis and embolism, first you should understand hemostasis. First, you should understand the steps of the hemostasis, because the steps of the hemostasis are same as that of thrombosis, and thrombosis will lead to embolism. So for understanding thrombosis and embolism, first you should understand hemostasis. So let me start with hemostasis. I will teach you the steps of the hemostasis. How does it occur? What is hemostasis? After that, I will come on the thrombosis, and after that, I will come on the embolism. Now coming on hemostasis. What is hemostasis? Imagine if I'm having a cut here at any part of the body. If I'm having an injury at any part of the body, a cut, an injury at any part of the body, what will happen? Of course, bleeding will happen. So that part will bleed, right? So we have blood vessels throughout the body. At every part of the body, we have blood vessels. So whenever we have injury at any part of the body, that part of the body starts bleeding. That part of the body starts bleeding, right? Now humans have 5 liter of blood. Human have 5 liter of blood. If bleeding continues within few hours, within a small duration of time, all the 5 liter of blood will be out of the body, and the person will die because of the shock. But this doesn't happen. We have cuts, we have injuries everywhere, every now and then, but we bleed. But it doesn't mean that all the blood is out of the body in bleeding. Bleeding continues only for few seconds or for few minutes. After few seconds or few minutes, bleeding automatically stops. Why does the bleeding automatically stop? Because of the mechanism. The site of the cut of the injury is sealed, and the bleeding is stopped automatically. It is known as hemostasis. Please split the term. Hemo means bleeding. What do you mean by hemo? Hemo means bleeding, and stasis means stop. Stasis means stop. Have you got it? So bleeding stops. So it is a physiological phenomenon. It is not a disease. So hemostasis is a physiological phenomenon which is required to stop the bleeding whenever we have injury at any part of the body. So it is good for us. It is useful for us. We want this hemostasis to take place. So just suppose I am having an injury here, there, anywhere on the body. If I am having bleeding, I want hemostasis to come in the role to stop the bleeding within few seconds or minutes, and it is useful for us. It is not a disease. It is not a disease. So what is hemostasis? Define hemostasis. What is it? So can I say hemostasis is a physiological process? It is not a disease. It is a physiological process whereby bleeding is stopped. We are stopping the bleeding after injury. So whenever we have injury at any part of the body, the bleeding is stopped by hemostasis. Thus, it protects the integrity of the vascular system. So if bleeding is stopped, then we are maintaining the integrity of the vascular system. If bleeding is not stopped, we will continue to bleed and the person can die, right, after the injury. So that is the definition of hemostasis. But why I am teaching you hemostasis before thrombosis? What is the difference between hemostasis and thrombosis? So in hemostasis, bleeding stops because of clot formation. So at the site of the injury, there is sealing. The site of the injury got sealed because of clot formation, right? Here the clot is formed after injury. That is hemostasis. Whenever we have injury, after that we have clot formation, so that the bleeding stops, and integrity of the vascular system can be continued, right? That is hemostasis. But imagine a situation if clot is formed without injury. Without injury, imagine I don't have any injury and inside the blood vessel small clots are formed. Then it is not a physiological thing, it is a disease, it is a pathological thing, it is not useful for us, so it will cause obstruction in the blood flow, so that is known as thrombosis. But the steps of thrombosis are same as that of hemostasis. The only difference between hemostasis and thrombosis is that hemostasis occurs after injury, thrombosis occurs without injury. Have you got it? So I am going to teach you two things, hemostasis and thrombosis. For understanding thrombosis, you should understand hemostasis, right? So hemostasis is a physiological thing. It is not a disease. Thrombosis is a disease. It is a pathological thing. In hemostasis, clot formation takes place. Here also clot formation takes place. But here clot formation takes place after injury. After injury to stop the bleeding. Here clot formation takes place without injury. Without injury. Have you got it? Have you got it? So this one is useful for us. It is physiological and useful, and this one is harmful for us. It is a disease and it is harmful. We do not want to form clot inside the blood without injury. Have you got it? Okay, let me draw two blood vessels in front of you to explain the concept correctly. So can you see this is a blood vessel? This is the endothelial lining of the blood vessel, right? And this is the site of the injury. Here we have an injury. Here we have injury. So here the injury is present. But see another blood vessel. I am drawing a parallel blood vessel. It is absolutely normal. It is uninterrupted and absolutely normal. This one is absolutely normal. There is no injury inside this blood vessel. Now I am forming the clot. I am forming the clot. Clot is made up of platelets. The clot is made up of platelets and coagulation factor, that is fibrin. Can you see this is the clot here? The clot is formed to seal the site of the injury. This is the clot. So here we want the clot till the healing takes place. After healing, I want to dissolve it. And here clot is forming without injury. The clot is forming of the platelet and coagulation factor only, but without injury. Here it occurs with injury, after injury. The clot is formed after injury. Here clot is formed without injury. Without injury. Without injury. Can you see? Here there is an injury and here there is no injury. So this is the clot. This is the clot. We can see the clot formation. So the first one, this one is hemostasis and it is useful. It is physiological. And this one is thrombosis. It is harmful and it is pathological. I hope now the concept is crystal clear to you. So first let me teach you hemostasis in detail. The steps of the hemostasis, how this clot formation takes place. The same steps we will apply here in thrombosis. The only difference, it occurs without injury. So let me start hemostasis. As I have already told you the definition of hemostasis. Hemostasis is a physiological process. It is not a pathological process which occurs after injury. So here clot formation takes place to seal the site of the injury, so that hemostasis takes place after injury. It protects the integrity of the vascular system. I hope you got it. Now how does it take place? There are four steps. There are four steps in hemostasis. I will explain you all four steps one by one. Let me draw a diagram, the same diagram. Can you see this is a blood vessel? This is the site of the injury. So this is the integrity in the endothelial lining. Please see the endothelial lining is continuous. This is the basement membrane. So this is the basement membrane, but at this portion, if you can notice this portion, the endothelial lining is disrupted. So this is the site of the injury, right? So as soon as, just suppose here I am having the injury. So this is my blood vessel and I am having an injury here. So just at the point of the injury, the blood vessel undergo vasoconstriction. So the first thing is vasoconstriction focally at the point where there is injury. So focally the blood vessel constricts. At that point the blood vessel. So why it is happening? Since there is injury now, so person is bleeding from this side. Person is bleeding. So the body is doing vasoconstriction at that point focally. So less blood is coming in this area, in this region. So less chances of bleeding. Less chances of bleeding. So body is doing it intentionally, automatically, the vasoconstriction. But this vasoconstriction which is taking place, focal vasoconstriction, it is transient. It is very transient. It is only for few seconds unless until you start to seal it. जब तक तुम sealing start करो तब तक the blood vessel remain vasoconstricted, it is transient. Have you got it? So the first step is vasoconstriction. Have you got it? Give me a thumbs up. So what is the first step? The first step is the vasoconstriction here. Vasoconstriction. Can you see the same diagram which I have drawn for you is given in the book like this? So can you see this is these diagrams are from the Robbins, right? You can see the endothelial lining is continuous, 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 continuous. Everywhere it is continuous here, and here it is discontinuous here. So this is the site of the injury. You can see the site of the injury, and at the site of the injury, if you appreciate, this is vasoconstriction. Can you see the blood vessel is vasoconstricting? So the first step is vasoconstriction, which is transient. We are done with the first step. Now I want to seal the site of the injury. Let me draw again the diagram, the same diagram for you. Now you can understand this is endothelial lining in the blood vessel, and this is the endothelial lining in the blood vessel, and here there is disruption. You can notice the disruption. This is the site of the injury. Now in the lumen of the blood, we have RBCs, we have WBCs, and we have platelet. I'm not interested in RBC. I'm not interested in WBC. I'm interested in platelet. So platelet will come and start sealing the site of the injury. So the site of the injury is first sealed. Now it's time to form the primary clot. So we will form two clots now. The first vasoconstriction is there. After that, I will form the primary clot, and after that, I will form the secondary clot. So let me form. Vasoconstriction is already done. Now I'm forming the primary clot. In primary clot, these platelets will come and they will form a bond with the basement membrane, that is subendothelial tissue. Can you see? This is the platelet, first row of platelet. Now please notice, please everyone notice what I am saying. This is the endothelium. The tissue below the endothelium is subendothelium. So platelets are basically forming a bond with subendothelium. Subendothelial tissue which is made up of collagen. So this is the first row of the platelet. Can you see? This one is the first row of the platelet. First row of the platelet, it is forming a bond. So how they are attaching and sealing the site, how they are doing so? Because they have receptors on their surface. The platelets, I will tell you the name of the receptors also. The platelets have receptors on their surface, and via this receptor they are forming the bond with the collagen which is present in the subendothelial tissue. This step is known as platelet adhesion. Platelet adhesion. What do you mean by platelet adhesion? In platelet adhesion, the platelet are coming and they are forming a bond with subendothelial tissue, the collagen of the subendothelial tissue. The first step is platelet adhesion. Now inside the platelet we have granules. There are two types of granules present inside all platelets: alpha granule and delta granule. Alpha and delta granule. As soon as the first step is over, the granules will be leaked out. They will come out, the degranulation from the platelet take place. So why the granules are going out? To call other platelets. There are many platelets in the blood. So these granules will go in the blood and they will call other platelets also that please everyone come and start sealing the site of the injury. We require more platelet. So this step, the second step, the degranulation is known as platelet activation. So it is activation of the platelet. So first adhesion take place. Adhesion में one row is completed. After that, the row which is completed, it will secrete granules inside it and release in the blood. So this step is known as platelet activation. In activation, alpha and delta granules are secreted in blood and call other platelets also. Now other platelets will come in role. The other platelets, they will form platelet over platelet. They will form second row, they will form third row, they will form fourth row, they will form multiple row. So platelet over platelet, one by one, they are laid over one another. So here also it takes place with the help of receptors. But here receptors are forming bond between platelet and platelet. Can you see the bond is formed between platelet and platelet? So platelet and platelet, this step is known as platelet aggregation. Have you got the three steps? Adhesion, activation, and aggregation. I will explain you again. Listen my words. So this is a blood vessel. This is the endothelial lining. You can see this is the site of the injury. You can see this is the site of the injury, crystal clear, the site of the injury. Now the first row of platelet is coming and forming a bond with the subendothelial tissue. So bond between platelet, let me write, bond between platelet and collagen, the subendothelial tissue collagen. This step is known as platelet adhesion. The first step is known as platelet adhesion. Adhesion में bond is formed. Can you see the bond? This bond is formed between the receptors of the platelet and receptors on the subendothelial tissue. That is the first step. The bond formation is not direct. It requires a bridge. It requires a bridge in between. So the bridge is von Willebrand factor. So von Willebrand factor is present as a bridge here, which is required for formation of bond between platelet and collagen in step of adhesion. So the first step is adhesion. Now granules are present inside the platelet. So when the first step is adhered here, so temporarily it is sealed. We require no, but only first one row is there. It cannot seal properly. It will break again, and the bleeding can start again. We want to make it strong. We want to strengthen it. So we want more platelet. For that, the granules present here, they will go in the blood. They will be degranulated. They will be going in the blood. So this step, the second step, this step is known as platelet activation. So after adhesion, we have activation in which granules, the two type of granules, alpha and delta, they are secreted in blood and they call other platelets also. Now other platelets will come in the role. Other platelets. So these are the other platelets. This is forming second row. Now other platelet forming third row. Other platelet forming fourth row and subsequently many rows. Now in all rows except first row. In all rows except first rows, we have bond formation between platelet and platelet. So here we have different receptor which form bond between platelet and platelet, which is forming bond. So this is known as aggregation. In aggregation, bond is formed between platelet and platelet. So see, please appreciate the difference between adhesion and aggregation. In adhesion, the bond is formed between platelet and collagen. In aggregation, the bond is formed between platelet and platelet. I hope you got it. So what are the three steps in sequence? In the second step, now the clot formed is known as primary clot. So basically primary clot is made up of platelet. The primary clot is made up of platelet. So temporarily sealing occurred. Have you got it? So there are three things. First, platelet adhesion, then platelet activation. The first is adhesion. The second is activation. And the third one is aggregation. The third one is aggregation. You got it? So these are the three steps which occur in sequence while formation the primary clot. This is how primary clot is formed. I hope you already understand the differences between them. In platelet adhesion, it is the formation of the first row. The bond is formed between the platelet and subendothelial tissue, the collagen of the subendothelial tissue, right? That is the first step. In activation, the granules are secreted in blood. The granules present in the first row, they go in the blood, the alpha granules and the delta granules. And in the last step, bond is formed between platelet and platelet. So subsequent, after the first row, the subsequent rows, second, third, fourth, they will be formed. And ultimately a clot is formed. The name of the clot is primary clot. See the same diagram which is given in the book. Can you see? This is the site of the injury. Please appreciate this is the site of the injury. So the endothelium is disrupted. Can you see the platelets? So this is the first row of the platelet. Can you see this one is the first row of the platelet? This one is showing adhesion. This one is showing adhesion, the first row, because it is forming bond between platelet and subendothelial tissue, the collagen of the subendothelial tissue. The second step is degranulation. Can you see the granules coming out of the platelet? If you zoom it out and can see this diagram, the granules are coming out. So this step is known as activation. Activation में the granules alpha and delta granules are coming out in the blood and they call other platelets for help. Now other platelets are coming for help. Can you see this is second row, this is third row, this is fourth row. So all this one is known as aggregation. Aggregation. In aggregation, the bond is formed between platelet and platelet. So ultimately, a clot is formed. Can you see a clot? Of course, you can see a clot. This clot is known as primary clot. This clot is known as primary clot, which is made up of platelet. Everyone give me a thumbs up. Now, you will say, ma'am, the primary clot is already formed. Now, why? What is the need of formation of secondary clot? The primary is sufficient. It has already sealed the site of the injury. Now, there is no bleeding, but this clot is unstable. Remember one thing. Primary clot is very unstable. Very unstable. If you don't stabilize it soon, it will break and bleeding will start again. So I do not want the bleeding to start again. I do not want this primary clot to break. So I have to convert the primary clot into secondary clot. The primary clot is unstable. Once we stabilize it, it is known as secondary clot. So how stabilization is done? How you will do the stabilization? Again, I will draw a diagram. I would like to draw a diagram. So again, this is the blood vessel. You can see the endothelial lining of the blood vessel. You can see the site of the injury. So this is the site of the injury. Please appreciate the site of the injury. So at the site of the injury, you can appreciate the primary clot. This is platelet adhesion. This is platelet activation. And this is platelet aggregation. Bond is formed between platelet and platelet. So ultimately, this clot is primary clot. It is platelet clot and primary clot. But this is unstable. Now, in the blood, In the lumen of the blood, we have coagulation factor. We have coagulation factors. How many coagulation factors we have? We have 12. Roman number 1, 2, 3. They are written in Roman numbers. 4. Likewise, we have 12 coagulation factor present in the blood. In biochemistry, you may have studied. In physiology, you may have studied it, and you know the names of various coagulation factors also. So factor number 1 is known as fibrinogen. Factor number 2 is known as thrombin, prothrombin. So likewise, we have various factors, but all of them are inactive in blood. So currently in my blood, they all are inactive. They are present in the blood, all 12, but they are inactive. Now, factor number 1 is known as fibrinogen. Fibrinogen, it is inactive. First, I will convert this fibrinogen into fibrin. I will convert this fibrinogen into fibrin. Fibrin is like a thread. It is like a thread. धागे के जैसा है. After getting activated, this fibrin will come here and ये thread बन जाएगा platelet clot के ऊपर. Can you see I am forming the thread? रस्सी के जैसा it will bind over the primary clot, and now this clot is known as secondary clot. It becomes stabilized. So what is the composition of secondary clot? What is the composition of secondary clot? It is already primary clot made up of platelet, along with it is stabilized now with fibrin. Fibrin is the first coagulation factor. But for that we have to activate fibrin. Fibrinogen is inactive. First we have to activate fibrin. I will tell you how we will activate it. So we have to activate fibrin, and after activating, it is forming a thread-like structure around the primary clot. So that primary clot got converted into secondary clot. Now it becomes stabilized. Now it becomes stabilized. Have you got it? Have you got it? Now the question arises, how you activate this fibrin? How you activate this fibrin? So, okay. So in the blood, there is factor number 1, 2, 3, write down in Roman number 4, 5. Likewise, we have 12 factors. All of them are inactive. I want to activate the first one. I am interested in first one. I am not interested in others. This first one is fibrin. Fibrinogen, which will get, I want to convert fibrinogen into fibrin. Fibrinogen is the inactive form. I want to convert it into active form fibrin. And this fibrin will do the stabilization. But I cannot directly activate one. For activating factor number 1, I have to start a cascade. I have to start a cascade. What do you mean by cascade? In cascade, one of the coagulation factor will cause activation of other. Other will cause activation of other. Other will cause. So it is like a cascade. So in the end, one will be activated. So what is the complete cascade? What is the sequence? So there are two pathways: intrinsic pathway and extrinsic pathway. If you talk about intrinsic pathway, factor number 12 is the first factor which get activated. 12 leads to activation of 11. 11 leads to activation of 9. 9 leads to activation of 8. 8 leads to activation of 10. In presence of 5, 5 leads to in presence of 5, 10 leads to activation of 2, and 2 leads to activation of 1. So this is the complete sequence in intrinsic. If you talk about extrinsic, in extrinsic, only one factor. The first factor is factor number 7. So it will lead directly to factor number 10. And from here it is continuous. It is continuous, it is same. So there are two pathways. You have to learn the sequence in both pathways. Have you got it? You have to learn the sequence. So if you talk about intrinsic, it is 12, 11, 9, 8, 10, 5, 2, 1. That is intrinsic. If you talk about extrinsic, so it is 7, 10, 5, 2, 1. So this one is common for both. So this is known as common pathway. Intrinsic pathway, extrinsic pathway, common pathway. Ultimately, factor 1 is activated. Whether you are following this one or whether you are following this one, ultimately 1 is activated. Activation of 1 means conversion of fibrinogen to fibrin, and that fibrin will cause the stabilization. Now see this diagram, the diagram given in the book. So can you see, this is the basement membrane everywhere. Here is the site of the injury. At the site of the injury, can you see the green color platelets? The green color are the platelets. But over the green color, can you see yellow color thread? Let me draw. So these are green color platelets. It is primary clot. Now over it, please try to see the yellow thread. If you zoom it out, you will see the yellow thread. This yellow thread is fibrin. It is fibrin. So this is a diagram of secondary clot. How this fibrin is activated? Either by extrinsic pathway, that is 12, 11, 9, 8, 10, 5, 2, 1. Ultimately 1 is activated. Or it is activated by intrinsic pathway. What is intrinsic pathway? It is 7, 10, 5, 2, 1. Ultimately 1 is activated either by intrinsic or extrinsic with common. So this is how secondary clot is formed. Have you got it? Now coming on the last step. So imagine again the same blood vessel. This is the blood vessel. This is the endothelial lining. This is the site of the injury. At the site of the injury, we already have primary clot formation. You know the 3 steps of primary clot formation: platelet adhesion, platelet activation, platelet aggregation. You know the steps. These are the steps. This is very unstable. I want to stabilize it. For stabilizing, this is the fibrin. I have used the coagulation factor. The coagulation factor fibrin is coming in role and forming a stability of the primary clot. So now this is secondary clot. So first we have formed primary clot and we have converted the primary clot into secondary clot. Primary clot is made up of platelet only. That is very unstable. Secondary clot along with platelet, there is coagulation factor. Which coagulation factor? Fibrin. So fibrin is doing the stabilization and now it is stable. Now it is stable. Now there is no bleeding. It is permanently sealed. The site of the bleeding is sealed, so there is no bleeding. But we cannot keep the clot here forever. We want to make the primary and secondary clot till healing take place. Now gradually this blood vessel, जहाँ पे endothelial lining disrupted थी, it is formed again. So healing takes place. Healing is complete now. Now this clot is no more required because the integrity is maintained. Healing is complete. So now healing is already complete. Healing is already complete. No more we require this clot. So we have to dissolve this clot. Why we have to dissolve? All blood vessels supply to some organ. So there is some organ. This is the organ to which this blood vessel is supplying. This blood vessel is supplying to this organ. If we keep the clot here forever, it is causing obstruction in the blood flow of the organ. That's why this organ will have ischemia if the clot will remain there forever. Now the healing is come. We want the clot till healing takes place. After healing, we want to dissolve it. So who will do the dissolution? Dissolution is done by plasminogen. There in the blood, there is a molecule known as plasminogen. It is inactive. First, it get converted into plasmin, and this plasmin cause the dissolution of the clot. How plasmin cause the dissolution of the clot? Plasmin has a tendency to cause the breakage of fibrin. The threads are broken down. So the secondary clot is lost and primary clot is unstable. So it is dissolved. So the plasmin basically causes what? Plasmin causes fibrinolysis. It is fibrinolysis. Fibrinolysis means fibrin. Lysis means degradation. So plasmin causes degradation of the fibrin. I hope my concepts are crystal clear to you. So the last step, you can see the last step is dissolution of the clot. You can see this is a clot. It is got dissolved by the plasmin. So these are the 4 steps. Now everyone give me a thumbs up. I will show you the theory. Everything is written in my notes. But first give me a thumbs up if you got this. The 4 steps, if you got this, now I will teach you thrombosis. After the steps, I will teach you, this is hemostasis. It is a normal physiological phenomenon. I am interested in thrombosis. I want to teach you what is thrombosis. So I will teach you the thrombosis now. Give me a thumbs up if anyone is listening live. Please give me a thumbs up. You got the 4 steps. So the first step is arterial vasoconstriction, followed by primary clot formation, followed by secondary. The primary clot got converted into secondary, stable clot, that is secondary clot, and in the end, stabilization and resorption of the clot. So these are the 4 steps, one by one we have to see. We have already understood, now see the theory. So first step is arterial vasoconstriction. It is immediate and it is transient. It is very transient. So can you see, here is the site of the injury, and at the site of the injury, as soon as injury take place, the blood vessel is doing vasoconstriction at this site, That is the first thing which is taking place. No more detail of this step. Coming on the second step, that is primary clot formation. Primary clot is made up of platelet. We have already seen. So it is made up of platelet. So primary clot is made up of platelet, only platelet. So there are 3 steps. Immediately after injury, platelet adhesion take place. Then platelet activation take place. Then platelet aggregation take place. I hope you know the differences between them already. Adhesion, activation, aggregation. So ultimately primary clot is formed. So in this diagram, you can see the first row of the platelet. This one. It is forming a bond with the subendothelial tissue, the collagen. So that is platelet adhesion. And can you see the granules are coming out? This is activation. And then the subsequent rows, the second, the third, the fourth, they are forming bond between platelet and platelet. So this is platelet aggregation. Give me a thumbs up. The same diagram. This is cross-sectional. Now this is longitudinal diagram given in Harsh Mohan. You can see this is the basement membrane. On the basement membrane, appreciate the endothelial lining. It is continuous, it is continuous, it is continuous. But here it is discontinuous. Can you see? At this point, it is discontinuous. So this is the site of the injury. First, identify the site of the injury. At the site of the injury, can you see this is the first row of the platelet, which is forming a bond. Can you see the red color receptors? So it is forming a bond with the subendothelial tissue. So this platelet is showing adhesion. After showing adhesion, the can you see the granules? These granules will come out. So they will call other platelets for help. So other platelets are coming, the second platelet and the third platelet, but it is forming bond between platelet and platelet. So these platelets are showing aggregation. Now different receptors are required for adhesion and aggregation. Have you got it? I will draw the same diagram for you. So let me draw the endothelial lining. Okay, just a second. Let me draw the endothelial lining. You can see here is the disruption of endothelial lining. So you can see this is the site of the injury. Endothelial lining is disrupted. So the first platelet, this is the first platelet. So what receptors are present on? So this is second platelet and this is third platelet, right? So what receptors are present on these platelets to form the bond? So let me draw here the first platelet. There are red color receptors on this platelet which will form the bond with the subendothelial tissue, the collagen. This is the collagen of subendothelial tissue. So these red color receptors are known as glycoprotein 1A2A. These are the receptors responsible for adhesion because these receptors form bond with the collagen of the subendothelial tissue. Please learn the name of the receptors, right? Now, as I have told you previously also, this receptor cannot form bond directly with the collagen of the subendothelial tissue. They require a bridge in between. So can you see purple color bridge is present? The name of the bridge is von Willebrand factor. So GP, glycoprotein, can you see GP1A2A? It forms a bond with the collagen via a bridge. The name of the bridge is von Willebrand factor. That is the summary. Have you got it? Now platelet form bond with another platelet. One platelet form the bond with another platelet with the help of another receptors. So these are the receptors which got connected with each other and it is responsible for aggregation. So what is the name of these receptors? It is glycoprotein, GP, glycoprotein 2B3A. It is 2B3A. It is 2B3A and this receptor is responsible for aggregation. Aggregation and no bridge is required here. Give me a thumbs up. Now there are two diseases I would like to add here. Two diseases I would like. If congenital absence of GP1A2A occurs, so in this person adhesion do not take place. Just suppose in my platelet I am having blood. Inside my blood I am having platelets. On my platelets GP1A2A is absent. So if I am having a cut here, so platelet want to form the primary clot. For formation of primary clot, the first step is adhesion. But adhesion do not take place because these receptors are absent. The disease is known as Bernard-Solier syndrome. Bernard-Solier syndrome. And imagine the other way around. If God forgot to give these receptors are defective, GP2B3A. So if I am having a cut, adhesion will take place, activation will take place, but aggregation do not take place. So only one row of platelet is formed, the subsequent rows cannot form aggregation. And this disease is known as Glanzmann syndrome. Both the patient bleed too much. They have excessive bleeding. Have you got it? The complete summary. Have you got it? Same diagram is shown here also. Appreciate the red color receptors here. The red color I am marking with purple now. These are GP1A2A responsible for adhesion. Adhesion. Have you got it? Appreciate the brown color receptors here. I am marking with blue. These one. So these are forming bond between two platelet and platelet. These are 2B3A and these are responsible for aggregation. Give me a thumbs up. And this is a इन दोनों के बीच का स्टेप है the second step between adhesion and aggregation. So can you see the granules? The platelet में से granules are coming out, right? So let me tell you the three steps one by one. So the first step is adhesion. For adhesion, the receptor is GP1A2A and a bridge is required. The name of the bridge is von Willebrand factor. Here in this step, the platelet are forming bond with the collagen in subendothelial tissue. That's why known as adhesion. So I am done with adhesion. The second is activation. In activation, there are two type of granules, alpha granule and delta. Delta are dense, alpha granules and delta granules. So what is the composition? What is the composition? What actually, tell me the can you see this is all composition of the granules. So tell me the name, what is present in which granule? There are two granules now, alpha granule and delta granule. Learn the composition of delta. Very important, जिस पे MCQ आते हैं. So what is the composition of delta granule? Delta granule contain, there is a mnemonic. Delta granule contain four things. The mnemonic is ACES, ACES. A means ADP, ATP, C means calcium, E means epinephrine, and S means serotonin. So these are the four things which are present inside delta granules, right? So activation is over. Now the coming on the third point. The third point is aggregation. It is platelet aggregation. Here, the bond is formed between platelet and platelet, adjacent platelets, platelet and platelet. The receptor requires GP2B3A. So what is the summary? GP1A2A and continue 2A के बाद आएगा 2B. GP2B3A, 3A. So GP1A2A, 2B3A. This is a receptor responsible for adhesion and this is a receptor responsible for aggregation, right? Via this receptor, platelet form bonds with subendothelial tissue, collagen of the subendothelial tissue. And here, via this receptor, platelet form bonds with another platelet. Right? Deficiency of this one leads to a disease known as Bernard-Soulier syndrome, and deficiency of this one leads to a disease known as Glanzmann syndrome. So Bernard-Soulier is a defect of adhesion. Adhesion do not take place. And Glanzmann syndrome is a disease or defect of aggregation. Here aggregation do not take place. So I cannot super simplify than this, right? So these are the defects. You can see Bernard-Soulier syndrome. It is a defect in adhesion because the receptor 1A, 2A is absent. 1A, 2A is absent. The second one, can you see this one? The red receptors are absent here. So adhesion do not take place. The second is Glanzmann's disease. It is a defect of aggregation. Here the receptor 2B, 2B3A is absent. So can you see these receptors? These receptors are absent, so platelet cannot form bond with platelet. So this was a diagram from Hirschhorn, this one. And this is a diagram from Robbins. So the same diagram, same information. You can see here also, you can see this is the subendothelial tissue, the collagen, the basement membrane. This is one of the endothelial cell, this is another endothelial cell. Between two endothelial cell, appreciate the discontinuity. That is the site of the injury. At the site of the injury, this is the first platelet which is coming and binding, so it is showing adhesion. It is forming bond with the subendothelial tissue via a bridge. The name of the bridge is von Willebrand factor. Can you see? And these two platelets, this one and this one, the red one, they are forming bond with platelet and platelet. So these are showing aggregation. For forming this bond, they require GP2B3A. Now see the two diseases. If the absence of GP1A2A occurs, it is Bernard-Soulier. If the absence of 2B3A occurs, it is Glanzmann. Everyone give me a thumbs up. I am done with primary clot formation. So we have done the first step, that is vasoconstriction. We have done the second step, that is primary clot formation. Now let me move on secondary clot formation. How secondary clot is formed? How primary clot got converted into secondary clot? Now, as I have told you, primary clot is very weak. It is unstable. We cannot stabilize it. So first we have to stabilize it. If we do not stabilize it, the primary clot will rupture and bleeding will restart. We do not want this. We want to stabilize primary clot. So we will do it with fibrin. We will do it with fibrin. So it is the deposition of fibrin over the primary clot. So primary clot के ऊपर जब fibrin आ जाएगा, now it is not known as primary clot. Now it is known as secondary clot. Now it is known as secondary clot. Right? Have you got it? But for this, the fibrin have to come in the role. Ultimately, we want fibrin. So we have to convert fibrinogen into fibrin. Insoluble. This is inactive. This is inactive and this one is active. We want to convert inactive into active. We can do it via two pathways, the intrinsic or the extrinsic, one of the two pathways. Can you see the two pathways in your diagram? This is intrinsic pathway. This is extrinsic pathway. So one of the two pathways will come in the role. Let me teach you intrinsic first. In intrinsic, it is factor number 12, which is the first factor to get activated. 12 will lead to activation of 11. You can see 11 will lead to activation of 9. 9 in presence of 8 will lead to activation of 10. 10 in presence of 5 will lead to activation of 2. And in the end, 2 leads to the activation of 1. So this is intrinsic pathway. Let me teach you extrinsic pathway. In extrinsic pathway, the first factor which comes in role is factor number 7. And 7 directly leads to the activation of 10. So from 10 onwards, it is common. Have you got it? So write like this with a simplicity. So 12 leads to activation of 11, leads to activation of 9. In presence of 8, it leads to activation of 10. In presence of 5, it leads to activation of 2. 2 leads to 1. 1 is fibrinogen, which got converted into fibrin. This is all extrinsic pathway. If you talk about intrinsic pathway, it is only one factor, that is factor number 7, which directly leads to 10. So from 10 onwards, it is common for both. So this is known as common pathway. This one is common pathway. This one is intrinsic. This one is extrinsic. So whatever is the pathway, the last coagulation factor which come in role is fibrinogen. Fibrinogen, which got converted into fibrin, and fibrin is doing the stabilization. It is like a thread. It is like a thread and it will bind the primary clot के ऊपर पूरा रस्सी से बंध जाएगा, thread से बंध जाएगा. Now primary clot is known as secondary clot. You got it? You got it? So can you see this diagram? Can you see this diagram? These are the platelets, the green color. On the platelets, you can see the yellow thread. The yellow thread is the fibrin. The yellow thread is the fibrin. It is doing the stabilization of primary clot. Now it is known as secondary clot. So you know what is intrinsic pathway. You know the sequence. You know what is extrinsic pathway. You know the sequence. You know what is common pathway, which is common for both. 10 onwards. So 10, 5, 2, 1. This is the common pathway, right? We are done with primary clot. It is made up of platelet. And the three steps are adhesion, activation, and aggregation. We are done with secondary clot. It is made up of platelet along with stabilized fibrin. So fibrin is coming and stabilizing the platelets. Then it is known as secondary clot. So fibrin comes either by intrinsic pathway or by extrinsic pathway along with common pathway. So that is the summary till now. In the end, you have to do the resorption. Resorption is done by plasminogen. Plasminogen in the blood got converted into plasmin and causes the resorption. So the clot is resorbed after the healing is over. Once the healing is over, we have to do the resorption. So we are done with 4 steps. What are the 4 steps? And this is known as hemostasis. This mechanism is required in human body for stopping the bleeding. For stopping, hemo means bleeding, stasis means stop. For stopping the bleeding after injury, we require this mechanism. Who will tell me the 4 steps? What are the 4 steps in the hemostasis? How does the bleeding stops in hemostasis? What are the 4 steps? Can anyone tell me the 4 steps? Just a second. Can anyone tell me the name of the 4 steps? So what is the first step? The first step is vasoconstriction. So immediately after injury, we have vasoconstriction. After that, the primary clot is formed. The primary clot is made up of platelet. So via platelet adhesion, activation, and aggregation, we have formed the clot. For adhesion, we require a receptor. The name of the receptor is GP, glycoprotein 1A2A. For aggregation, we require another receptor. The name of the receptor is GP2B3A. 2B3A. And for activation, there are granules present in the platelet will come out. Degranulation will take place. Two type of granules are present, alpha and delta. We have seen the composition of delta. There is a mnemonic aces. We have studied few diseases also here. So if this receptor is absent, the disease is known as Bernard-Soulier. It is a defect of adhesion. And if this receptor is absent, the disease is known as Glanzmann syndrome and it is a defect of aggregation. That is a summary of primary clot. But primary clot is very unstable. You have to stabilize it and convert into secondary clot. So the third step is formation of secondary clot. In secondary clot, we have to stabilize the platelet clot, the primary clot along with fibrin. So fibrin is factor number 1, coagulation factor number 1. We have to activate it. We have to convert fibrinogen to fibrin so that it can stabilize the primary clot over the platelet like a thread. How you will do that? You can do that via 2 mechanisms, either extrinsic pathway or intrinsic pathway. If you ask me the sequence in extrinsic pathway, I will tell you the sequence. It is factor number 12, followed by 11, followed by 9, followed by 8, followed by 10, 5, 2, 1. If you ask the sequence in this one is the sequence in intrinsic. Intrinsic. If you ask the sequence in extrinsic pathway, the answer is 7. 7 followed by common, that is 10, 5, 2, 1. 7, 10, 5, 2, 1. So you can see 10, 5, 2, 1 is coming in the both, right? So ultimately the last is the 1. So 1 is fibrinogen. That is got activated either by extrinsic or intrinsic and it is stabilizing the platelet clot. That is a summary of the secondary clot. After that, we have to dissolve the clot. That is done by plasminogen. So that is the summary. So you can see the first step. We have done vasoconstriction. You can see the second step, the primary clot formation, which is made up of platelet, adhesion, activation, aggregation. You can see the secondary clot formation, which is made up of platelet along with fibrin. The yellow color thread is the fibrin. Fibrin is coming in role either by extrinsic pathway or intrinsic pathway. And last is the resolution. The resolution is done by the plasmin. So plasmin is doing fibrinolytic activity. That is degradation of the fibrin. So I am done till now. Everyone give me a thumbs up. Anyone listening me live, please give me a thumbs up. So we have done hemostasis till now. Let me start now thrombosis. Let me start the thrombosis now. That is my topic for this lecture, thrombosis and embolism. So let me start the thrombosis. So what is thrombosis? Give me a minute. Let me move on the topic. I'm skipping the polls. Yeah. So let me start thrombosis. Why I have taught you hemostasis before thrombosis? Because thrombosis may be clot is forming. So as I have told you, let me draw 2 blood vessels. This is a blood vessel and this is a blood vessel. Let me draw 2 blood vessels. In the first blood vessel, there is injury. You can see. In the second blood vessel, there is no injury. The endothelial lining is continuous. In the first, you can see this is the endothelial lining disruption. So there is injury. So here injury is present. Here injury is absent. Here injury is present. Here injury is absent. We can see. So clot formation takes place here. If clot formation takes place in an injured blood vessel, it is known as hemostasis. It is known as hemostasis. We have seen the steps of hemostasis, the 3 steps, the 4 steps of hemostasis. It is a physiological phenomenon and it is useful for us. It is required to stop the bleeding. But if the same steps occurs without injury, so clot is formed inside the blood vessel without injury, so it is not known as hemostasis now. Now it is known as thrombosis. It is known as thrombosis, and it is not physiological. It is a disease. It is a pathology. It is not normal, and it is not useful. It is harmful. It is harmful because without injury, this blood vessel is giving blood to some organ, supplying some organ, right? Due to the formation of the clot, the organ get compromised of the blood. There is obstruction in the blood flow, so organ is receiving less blood. So organ can have ischemia if the thrombus is present permanently. Have you got it? Come one step more further. So this is known as thrombus. It is attached to the blood vessel wall, which is uninjured. It is uninjured, so it is attached there. Once the thrombus got detached, यहाँ से टूट जाए ये, detach हो जाए. Once the thrombus got detached, now it is known as embolism. It is known as embolism. You got my point? So what is thrombosis? So I am going to teach you thrombosis under following headings. You can see the headings under which I am going to cover the topic, that is thrombosis. Very, very, very important topic. I am going to teach you the definition of thrombosis, the pathogenesis. The question arises why. You already got the definition. Thrombosis also, the clot is formed without injury. Without injury. Without injury, the clot is formed via same mechanism. First, a primary clot is formed, which is made up of platelet. Then secondary clot is formed, which is made up of platelet along with fibrin. So the same mechanism, but it is without injury. Now the question arises why? Without injury, why it is formed, right? So here comes the role of Virchow triad. I will explain you. I will teach you the 2 or 3 types of the thrombosis. I will teach you the gross clinical features, differences between artery thrombus and venous thrombus, and what is the fate of the thrombus. So I will explain you all these features one by one. Give me a thumbs up. Let me start my today's lecture, today's topic, thrombosis. What is the definition of thrombosis? So as I have told you, in thrombosis, we have clot formation. Clot formation inside a blood vessel without injury. It is a pathological and it is harmful. The clot is made up of 2 things. The primary clot is made up of platelet and secondary clot is made up of fibrin along with platelet. So it is fibrin platelet clot. The fibrin platelet clot is known as thrombus because it is formed without injury. It is known as thrombus. So that is the definition. Give me a thumbs up. See a beautiful diagram. Can you see a blood vessel? Inside the blood vessel, please appreciate this is a thrombus. And it is unruptured, uninjured. So what is the difference between hemostasis and thrombosis? Hemostasis mein clot is formed after injury to blood vessel. Thrombosis mein clot is formed in unruptured blood vessel. Right? So hemostasis is useful for us. It is used for stopping the bleeding. For stopping the bleeding. Thrombosis is harmful for us because it will cause ischemia. But the steps are same. Here also primary and secondary clot is formed. Here also primary and secondary clot is formed. Everyone give me a thumbs up. Can you see a blood vessel, a beautiful blood vessel? Please appreciate the thrombus inside it. It is uninjured. Uninjured में thrombus है. A beautiful diagram. Can you see a blood vessel? See the platelets, the clot formed, the clot in uninjured blood vessel. Can you see these are the platelets, the yellow one. These are the platelets, the star shaped. ये बड़े बड़े RBCs हैं. RBCs and platelets are there, and over it can you see a yellow color thread? The yellow color thread is the fibrin. So this is an actual diagram of a thrombus, the primary clot as well as secondary clot. See another beautiful diagram. Okay, can you see a blood vessel here? Yes, you can see a blood vessel. Inside the blood vessel, can you see this is clot formation? It is uninjured and clot is formed. That's why it is known as thrombus. It is made up of platelet and fibrin. It is known as thrombus. Once the thrombus detach from here, can you see it is detaching? After detaching, it will flow along with the flow of the blood. Now it is no more thrombus. It is known as embolus. So first, let me teach you thrombosis. Then I will come on the next topic, embolism. Give me a thumbs up. So the definition is over. So in thrombosis, a clot is formed in uninjured, without injury, uninjured blood vessel. Uninjured blood vessel, if a clot is formed, it is known as thrombosis. Now the question arises why it is forming. What is the reason? What is the pathogenesis? Without injury, why it is forming? So there are 3 reasons. 1, 2, 3. So the 3 reasons were discovered by a scientist known as Virchow. That's why it is known as Virchow triad. What are the 3 reasons? What are the 3 reasons? Number 1, endothelial injury is there. I will explain you what is endothelial injury. Number 2, abnormal blood flow is there. Blood flow में abnormality, there can be 2 abnormalities. Either stasis of the blood flow or turbulence of the blood flow. Turbulence of the blood flow, one of the 2 abnormalities is there. And third, hypercoagulability of the blood. the blood become hypercoagulable. Because of any of the three reasons, it can lead to thrombosis. It can lead to thrombosis. Have you got it? Either by endothelial injury or abnormal blood flow or hypercoagulability. These three reasons are known as Virchow triad. It is multiple time asked in your exam. Virchow triad. इस पे बहुत MCQ आता है. Multiple time this MCQ is repeated. That is what is Virchow triad. So that is about the Virchow triad. Have you got it? So what are the three things which constitute Virchow triad? Number one, endothelial injury. Number two, abnormal or altered blood flow, that is stasis or turbulence in the blood flow. And number three, hypercoagulability. I will explain you these three things one by one, and these all will lead to thrombus formation. They all will lead to thrombus formation, right? The first thing I'm saying, endothelial injury, then alteration in blood flow, then blood hypercoagulability, that will lead to thrombus formation. It is known as Virchow triad, right? Okay, let me start the endothelial injury. The first is the endothelial injury. Listen, I'm drawing a blood vessel here. This is a blood vessel and this is the endothelial lining. This is the endothelial lining. You can see this is the endothelial lining is there. Inside the lumen of the blood vessel, we have some toxins. There are some drugs or toxins are present. Drugs or toxins are present in the lumen of the blood vessel and they are causing injury to the endothelium. If the endothelium got injured, the platelet will come and form a clot here. Even a minute injury can lead to the clot formation. So can you see, endothelium injury is there with the help of the drugs or toxin endothelial, but it was not bleeding. Only endothelium was minutely disrupted. It was not bleeding. Still clot is formed. Now this clot is not hemostasis, it is thrombus. So that is the first reason, endothelial injury. Endothelial injury can lead to the formation of the thrombus. First thing, endothelial injury. The second is altered blood flow. The mechanism is same. How it is formed, the mechanism is same. So first primary clot is formed made up of platelet by the three mechanism: adhesion, activation, aggregation, and then the secondary clot is formed. The secondary clot is formed with the help of coagulation system, either extrinsic pathway or intrinsic pathway. Ultimately, fibrinogen got converted into fibrin and fibrin stabilizes the primary clot. So primary clot is made up of platelet which got stabilized with fibrin, right? So that is the first reason. Coming on the second reason, altered blood flow. Okay, altered blood flow. What is normal blood flow? First, you should understand what is normal blood flow. So let me draw a blood vessel. Inside blood vessel, we have RBC, we have WBC, we have platelet, and we have plasma. Now, have you heard about Bernoulli's theorem? You may have studied Bernoulli's theorem in your childhood in physics. What does this theorem say? Whenever fluid travels in any pipe, blood vessel is a pipe. Whenever fluid is the blood, travels in any pipe, the heavy portion of the fluid travels at the center. So what is the heavy among the blood? Among blood, most heavy is the WBC. So WBC travels at the center. This is all WBC. After that there is RBC. So RBC is at the aspas of WBC. WBC के आसपास है RBC. After that we have platelets. So platelets are the lightest. They are the lightest. They are the smallest. So they travel at the periphery. And most lightest is the plasma. So plasma is there. A rim of plasma is there. So this is the plasma. So this is, I am applying Bernoulli's theorem in the blood. So center, the purple color you can see, it is WBC. The red color you can see is RBC, and the green color you can see is the platelet, and yellow is the plasma. Can you see this is endothelial lining? Of course, you can see the endothelial lining. Now, platelets are not in contact of endothelial lining. The platelets, the green color platelets are separated from endothelial lining by plasma, by a layer of plasma. What I am saying, I am repeating again. The platelets are separated from endothelium. They are separated from endothelium by layer of plasma. By layer, this is normal blood flow and this is known as axial blood flow. So in axial blood flow, the platelets are separated from endothelial lining by layer of clear plasma. But imagine a situation, this is in flowing blood. This is normal axial blood flow. This occurs in flowing blood. Imagine the blood flow stops. That is blood stasis is there. That is stasis of the blood is there. Blood flow stop. The stasis of the blood is there. Due to the stasis, due to gravity, everything falls down. So platelet will come in contact with the endothelium. So high chances platelet will form a clot. Have you got it? That is known as, so normal blood flow is axial blood flow. That is laminar blood flow. So heavy things travels at the center. So RBC and WBC travel at the center. Slower things, that is platelet, travel at the periphery. And slowest is the plasma. It is the plasma, it is at the most periphery. So normally platelets are separated from endothelium by a layer of plasma. Platelets not in direct contact of endothelium. See the endothelial lining? This is the endothelial lining. Please appreciate the endothelial lining. Please appreciate the platelets. They are present here. So platelets are not in direct contact of the endothelium. If platelet comes in direct contact with the endothelium, high chances they will stuck there and form a clot. But they are separated by a clear plasma. Thankfully, God has given us plasma, which is separating the platelet from the endothelium. Have you got it? Now, either turbulence or stasis. These are the two reasons of altered blood flow. If altered blood flow takes place in human body, altered blood flow means either turbulence or stasis. One of the two things taken place. So that is stasis की वजह से क्या होगा? Now compare the two diagram. Due to the gravity, everything is falling. Everything is falling and platelet are coming in direct contact with the endothelium. Can you see? And they will form a clot here. So turbulence leads to clot formation in artery and stasis leads to clot formation in a vein. It is a rule. Learn this rule. So turbulence is unequal blood flow. Stasis is stoppage or slowing of the blood flow. So turbulence leads to clot formation in the artery and stasis leads to clot formation in the vein. Give me a thumbs up. So that is altered blood flow. Altered blood flow is of two types, turbulence and stasis. Turbulence and stasis. Turbulence leads to clot formation in the artery and stasis leads to clot formation in the vein. Have you got it? That is altered blood flow. So we have done the endothelial injury. We have done altered blood flow. Last is hypercoagulability of the blood. What do you mean by hypercoagulability of the blood? Okay. So can you see this is a blood vessel? Inside the lumen of the blood vessel, this is the endothelial lining. Inside the lumen of the blood vessel, in the blood, we have two type of things. One are anticoagulatory material, anticoagulatory proteins, and one are procoagulatory material, procoagulatory proteins. So anticoagulatory are the something which opposes coagulation, and procoagulatory are something which promotes coagulation, as the name indicate. Normally in my blood, your blood, all healthy human being blood, they are equal and opposite. So they balance each other. So clot is not formed because anti is balanced by the pro, right? Both are balancing each other. Imagine if I am having a cut here. If the person is having an injury anywhere or a cut here, at that time, the procoagulatory increases tremendously as compared of anticoagulatory. So pro will increase and it will lead to clot formation, so imbalance occur. But if without injury, imbalance is occurring. Either anti is decreasing or pro is increasing without injury, it will lead to clot formation, and the condition is known as hypercoagulability. Coagulability. So that is the blood become hypercoagulable. So hypercoagulability, that is the reason. This can happen in various types. You can read the reasons by your own. So I am done with the Virchow triad. In the Virchow triad, we have seen the three. What are the three reasons? In pathogenesis, we have studied Virchow triad. Virchow triad. In Virchow triad, I taught you the three reasons of clot formation. What are the three reasons of thrombus formation? So first is endothelial injury, number one. Number two, altered blood flow. That is the two type of alteration. Either stasis is there or turbulence is there. Turbulence lead to clot formation, thrombus formation in artery, and stasis lead to thrombus formation in vein. And the third is hypercoagulability of the blood. Have you got it? The third reason is the hypercoagulability of the blood. Have you got it? Now coming on the types of thrombus. How many types of thrombus you know? How many types of thrombus you people know? How many types of thrombus you know? There are three types of thrombus. If the thrombus is forming in artery, it is arterial thrombus. If it is formed in the vein, it is venous thrombus. And it is formed in the heart, it is cardiac thrombus. Right? So I will talk about the three thrombus one by one. Right? As I have told you, arterial thrombus is formed because of turbulence, and venous thrombus is formed because of stasis. Right? Arterial thrombus contain more platelet. That's why they are white in color. They are white in color. Venous thrombus contain more RBC. That's why they are red in color. They are red in color. You got it? You got it? So I will tell you the differences between the two type of thrombus. Basically, cardiac bhi hote hain, but not very common. The main are arterial and venous thrombus. So these are the three type of the thrombus. Right? Come on the gross. Can you identify whether it is an arterial thrombus or venous thrombus looking at the diagram of the thrombus? You can. What are the gross differences in the two type of the thrombus? Give me a minute. Let me see your chart. Yes, I can see your chat. So tell me the gross features of the thrombosis. What are the gross features of the thrombosis? Okay, grossly, if you see the arterial thrombus or venous thrombus, I will draw the two diagrams for you. Let me draw a artery. This is a artery. Let me draw a vein. Let me draw a vein. This is a vein. You can see one is the artery, one is the vein. This one is the artery. This one is the vein. Let me draw a thrombus here also. So this is a thrombus here, and let me draw a thrombus here also. So this is the thrombus here, right? This is the thrombus here. So what are the differences you can see? Arterial thrombus, as I have told you, the arterial thrombus, and venous thrombus, these are the two type of thrombus. Arterial thrombus is white in color. The venous thrombus is red in color. Venous thrombus have more RBCs. That's why red in color. Arterial thrombus have more platelets. That's why white in color. That is the first difference. Arterial thrombus is not completely obstructive. It is partially obstructive. And here it is completely obstructive. It is completely obstructive. So partial obstruction is known as mural. It is mural in nature. And venous thrombus is occlusive in nature. Occlusive in nature because of complete obstruction. So here partial obstruction, here complete obstruction. You got the differences till now? You got the differences? The next difference, okay, let me tell you. So arterial thrombus and venous thrombus. Arterial thrombus, you can see it is white and it is mural. That is partially obstructed. And venous thrombus, if you see, now see, this is the diagram of arterial thrombus. Can you see the lumen of the artery? This is intima, and this is all media, and this is all externa. See the three layers of the artery. Inside that, please appreciate the thrombus. This is the thrombus. Now see, it is partial. It is not complete. It is partial. This one is partial. Now inside it, see the alternate line. So this is a line of platelet. This is a line of RBC. Line of platelet, line of RBC. These lines are known as lines of Zahan. So arterial thrombus में lines of Zahan are present. They are present. But in a venous thrombus, the lines of Zahan are absent. Lines of Zahan, the alternate light and dark lines, alternate platelet and RBC lines, they are absent in venous thrombus. Have you got it? Now see the two diagram. Can you see the lumen? Can you see this is the artery? See the lumen, see the artery, see the lumen, and see the artery, see the lumen. Now see the thrombus in each of them. This thrombus is partially obstructed, so it is mural. It is arterial one. This one is complete obstructed. It is occlusive, so it is seen in the veins. And this is detaching from here and moving in the blood. So this one is known as embolus. Give me a thumbs up. Give me a thumbs up. So venous thrombus is red. Arterial was white. Venous is red. Arterial was partially obstructed. That is mural. So venous one is occlusive. In arterial one, lines of Zahan are present. In venous one, lines of Zahan are absent. Have you got it? Have you got it? So let's see the differences between arterial and venous thrombus. The last thing, the differences between arterial and venous thrombus. I will come on that. Before that, clinical features. Now you yourself tell me, this is the organ. Let me draw an organ here. Okay. This is the artery for this organ carrying pure blood to this organ. And this is the vein for this organ carrying impure blood away from the organ. And this is the direction of flow. So blood is flowing in this direction. Now imagine a situation if thrombus is present in the artery. There is a thrombus which is present in the artery. What will be the clinical effect? What will be the clinical effect? What will be the clinical effect of this thrombus? So since what will happen? Common sense, apply common sense. So since there is no blood or less blood is flowing to the organ, so arterial thrombus leads to ischemia of the organ. Arterial thrombus leads to ischemia and infarction of the organ because there is less blood flowing to this organ, right? Now the other way around, imagine the thrombus is present in the vein, not in the artery. Artery is normal, but thrombus is present in the vein. Thrombus is present in the vein. You tell me what will happen? What is the clinical reason? I'm coming on your question, Kishore. First tell me what will happen in vein? What will happen in vein? If the thrombus is present in vein, the organ is receiving proper blood. The organ is receiving the proper blood, but pure blood. But impure blood cannot be coming out. Impure blood will get gathered there. So organ will become congested. Organ will become congested by impure blood. So edema will happen. Edema will happen. Congestion and edema will be the result of venous thrombus. Have you got it? Give me a thumbs up. So arterial thrombus result in ischemia and infarction, and venous thrombus results in congestion and edema. Now, Kishore, you are asking why lines of Zahan are not seen in venous thrombus, right? That is your question. So in venous thrombus, the answer is slow. Blood flow is very slow. In artery, the blood flow is very fast, very fast. In artery, the blood flow is very fast. In the veins, the blood flow is very slow. That's why when thrombus is formed in the artery, so alternate layers are formed. Alternate layers are formed here because of the fast blood flow, right? So one row is of platelet plus fibrin, that is a light, and other row is RBC, that is dark. Again one row of platelet plus fibrin, which is light. Again another row of RBC, which is dark. So alternate light dark bands are there. But in vein, the blood flow is very slow. And here, mostly the thrombus is made up of RBC with few platelets. Maximum RBC are there and few platelets are there, and very less fibrin is there. So it is a dark color thrombus, and that's why the color is red here, the color is white here. So lines of Zahan are present in artery and absence in vein because of the difference in blood flow in artery and vein. That is the answer given in the books. Give me a thumbs up, Kishore. You got your answer? You got the clinical features? You got the clinical features? What are the two type of the clinical features? Yes or no? Just a second. Just a second. You got the clinical features? Okay. So that is the thing. Okay, let me see if I can see your chat. Give me a minute. Yeah, I can see it. So that is the difference between the clinical features of the two type of the thrombus, right? Now, let me tell you all the differences between arterial and venous thrombus. So clinical effects we have seen, arterial thrombus result in ischemia and infarction, and it can lead to the gangrene, arterial. But venous thrombus basically results in edema. It results in congestion and edema. That is the difference in the clinical features of the two type of the thrombus. Now let me teach you the differences between arterial and venous thrombus, the various differences between the arterial and the venous thrombus. Can you see arterial and venous thrombus? The two type of the thrombus, the arterial thrombus and the venous thrombus. Can you see the arterial and venous thrombus? Okay. What are the differences? Arterial thrombus basically formed due to turbulence, and venous thrombus basically formed due to stasis of the blood, as I have already told you. Arterial thrombus, here the blood is active flowing, and here the blood is sluggish flowing. Fast flowing blood, slow flowing blood. We already know. Name some arteries in which thrombus is formed commonly. Most common it is formed in coronary artery of the heart, in cerebral artery of the brain, and femoral artery. Learn these three arteries: coronary, cerebral, and femoral, in which thrombus formation is very common. Among the veins, thrombus formation basically occurs in leg veins, superficial and deep leg veins, number one, and ovarian and periuterine veins. Right, so leg veins, ovarian vein, and periuterine veins. These are the three veins. Learn the example. Learn the example. One more thing I would like to explain you. Let me draw an artery, and this is the artery. Let me draw a vein. Let me draw thrombus in both of them. So this is a point of attachment. From here, the thrombus is arising in the artery, and this is the point of attachment. From here, the thrombus is arising in a vein. After arising, this is the direction of the blood flow in the artery. This is the direction of the blood flow in the vein. We can see the direction of the blood flow in the artery and the vein. Now, what is the direction of the growth of the thrombus? In artery, the thrombus grow opposite to the direction of the flow. And in vein, the thrombus grows in the same direction of the blood flow. That is the growth. That is the growth of the thrombus. So in artery, it takes place in opposite direction as that of blood flow. In vein, it takes place in the same direction. Here opposite direction, here same direction. The growth of the thrombus is in opposite or same direction to the direction of the blood flow. So this one is known as retrograde propagation, and this one is known as this one is retrograde, this one is known as antigrade propagation. Antigrade, have you got it? So in artery we have retrograde manner of growth, and here we have antigrade manner of growth from the point of attachment. I hope you got this point. Lines of Zahan we have already seen, it is present in artery, and lines of Zahan are absent in the vein. We have already seen it. The arterial thrombus are white in color. They are basically because they basically have more platelet, and venous thrombus are red in color because they have more RBCs. They have more RBCs. Complication, they result in ischemia and infarction. Arterial thrombus and venous thrombus result in edema and congestion. Embolism is more common. The detachment is more common in vein as compared to artery. Everyone gave me a thumbs up. Have you got it? These differences are ultra important for your MCQs. You have to learn these differences. There is no escape. There is no escape. So we are done with the differences between arterial and venous thrombus. Now tell me the fate of the thrombus. What will happen? Imagine a situation, a thrombus is there in the artery or vein. So this is the diagram of a thrombus. Without injury, a thrombus is there. Either in an artery or vein, the thrombus is present. What can be the various fate? What can be the various fate? Either with time it decreases in size. It can decrease in size. With the time it decreases in size. Why it will decrease in size? Because in the blood we have plasminogen. You know, I have already taught you what is plasminogen. Plasminogen will get activated, convert into plasmin, and plasmin cause the dissolution of the clot. Because plasmin have fibrinolytic activity. Fibrinolytic activity, it will cause dissolution of the fibrin, that is the threads, and the clot can dissolve. So that can decrease in size, and this one decrease in size is known as resolution. So the first fate is resolution. Rarely it can resolve, but yeah, it can do so. Either it can do so, number one. Number two, it fixes in size, not decrease. It is fixing in size. The size is fixed. It is fixed. It is known as organization. The clot is organized either due to calcification or something else. It is organized. The size is fixed. Or the third thing, it can increase in size. It can increase in size. With time, it is going on increasing in size. It is increasing in size with time. So this thing is known as either it is resolution, or it is organization, or it is propagation. It is propagating. It is propagation. It is moving. It is more growing. Propagation. And the last one, it can detach. It can detach from its site. It can detach from here and move with the blood. So this is known as embolism. This is known as embolism. So these are the four fates of a thrombus. Either it decrease in size, or fix in size, or increase in size, or detach. If it decrease in size, it is known as resolution. If it fix in size, it is known as organization. If it increases in size, it is known as propagation. And if it detached from its point, it is known as embolism. Give me a thumbs up. So these are the fate. You can see the four fates of the thrombus. Can you see it is decreasing in size? So that is resolution. It is fixed here. That is organization. It is increasing either antegrade or retrograde, depending whether it is present in artery or vein. That is propagation, and it is moving to some other organ by detaching. So it is known as embolism, the thromboembolism. Everyone give me a thumbs up. So do you know the definition? I am done with thrombosis. Do you know the definition of thrombosis? Yes, you all know the definition of thrombosis. That is formation of clot in the blood vessel without injury. If it occurs with injury, it is known as hemostasis, which is a physiological phenomenon. But thrombosis is a disease. Here the clot is formed without injury. The pathogenesis, I have told you, Virchow triad. So what is Virchow triad? There are three things which leads to thrombus formation. Endothelial injury, the first one is the endothelial injury. The second is alteration in blood flow, that is turbulence or stasis. Turbulence leads to clot formation in artery, stasis leads to clot formation in the vein. And the third thing is hypercoagulability of the blood. Never forget Virchow triad. Virchow triad is the pathogenesis of thrombosis. Coming on the types, there are three types of the thrombus: the cardiac thrombus, the arterial thrombus, the venous thrombus. Cardiac are not important, but arterial and venous are important. Coming on the gross, how grossly they differ from each other. So grossly, arterial and venous thrombus, I have told you the differences. So arterial thrombus are white in color, venous thrombus are red in color. Arterial thrombus are mural, that is partially obstructed. Venous thrombus are occlusive, that is completely obstructed. The arterial thrombus lines of Zahan are present, and venous the lines of Zahan are absent. Clinical features already told you. If it is arterial thrombus, it can lead to ischemia and infarction. If it is venous thrombus, it can lead to congestion and edema. We have seen the differences, various differences between arterial and venous thrombosis, and we have seen the fate, the four fate of the thrombus. Either it decrease in size, fix in size, increase in size, or detach. These are the four fates. So the name of the four fates, if it decrease in size, it is known as resolution. Fix in size means organization. Increase in size means propagation, and detached from its size, it is known as embolus. Embolus. Have you got it? Now my next topic is embolism. We are done with thrombosis. Do you have any doubt with thrombosis? The next topic of teaching is embolism. Everyone give me a thumbs up first. Everyone give me a thumbs up. Have you got it? Have you got it? Should I proceed ahead to the embolism? The next topic is embolism here. Embolism. So what is embolism? I have already defined embolism. Embolism, okay, listen. This is a blood vessel. Inside the blood vessel, let me draw a blood vessel. Inside the blood vessel, if any, listen now, any solid or liquid or gas, any mass is traveling in the blood vessel. In the blood vessel. Now this mass is originated at some point. With the flow of the blood, it is moving to another point. So this is the point of origin. This is the point of origin. It is not causing disease at the point of origin. The embolus is not causing the disease. It is causing disease at some distant point. It is moving with the flow of the blood. So this is known as embolus. It can be solid, it can be liquid, it can be gas. So that is the definition of embolus. If it is 90%, it is arising from thrombus. So a thrombus got detached and it is moving now. So that is solid. Solid embolus, it is known as thromboembolism. 90% time it is solid only, that is thromboembolism. But sometimes it can be liquid, it can be gas. Give me a thumbs up. So what is embolus? Embolus is a detached intravascular mass. It can be solid, liquid, or gas mass. It is detached intravascular mass. It is carried by the blood, by the flow of the blood from the point of its origin to a distant site, and it causes disease at the distant site, not at the point of the origin. The mechanism is known as embolism, and the thing which is forming is known as embolus. You got it? So you can see this is a blood vessel, a beautiful diagram of the blood vessel. In the blood vessel, first at this point the thrombus is formed. Thrombus is something which is attached to the blood vessel. It is attached. Once it got detached, it is freely moving in the blood vessel. Now this is known as embolus. It is solid. Since it is formed from thrombus, it is known as thromboembolus. Thromboembolus. It is the most common embolus. 90% time the embolus is this one. It is solid. Sometimes it can be liquid, it can be gas, right? So thromboembolus. Now let me teach you the classification of emboli. The classification of the emboli. We can classify the emboli by 4 ways. The first way depends on the matter, whether it is solid or liquid or gas. In the solid, there are 2 examples. The first example in the solid is thromboembolus. Again, a beautiful diagram. Can you see a blood vessel? You all can see a blood vessel. Can you see this is a thrombus? Since it is attached to the wall of the blood vessel. Once it got detached, now this is known as embolism. So this embolism is known as thromboembolism. This embolism is known as thromboembolism. 90% times it is this one only, and it is solid. It is solid. The second example of solid, you can see what it is. It is fat embolism. Fat. So fat molecules, the adipose cells accumulate together and they form a solid embolus. So fat embolism, why it is formed, I will tell you the reason. Don't worry. So this one is the fat embolism. Can you see it is fat? So 2 examples of solid in your syllabus is thromboembolism and fat embolism. These 2 are solid. Let me come on liquid embolism. This is amniotic fluid. Sometimes the bubbles, not the bubbles, the liquid amniotic fluid will form a mass, and it is amniotic fluid embolism. It is coming at the time of the labor pain in the mother. In the mother, at the time of the labor pain in the maternal placenta, it can arise, right? So amniotic fluid, it is liquid now. That's why it is an example of liquid embolism. And in the gas embolism, it can be the air embolism. So air is present. The bubble of the air is present in the blood vessel. So it is the gas embolism. So that was the first classification. That was based whether it is solid or liquid or gas. The 3 types of embolism based on the matter. The matter is solid or liquid or gas. In the solid, I taught you 2 examples, thromboembolism and fat embolism. In the liquid, I taught you only 1 example, amniotic fluid embolism. And in the gas, it is air embolism. Have you got it? The second, depending whether the embolus. So this is a blood vessel. Inside the blood vessel, this is the embolus. Now, it doesn't matter whether it is solid or liquid or gas. What matters is whether bacteria are present on this or not. That is, the embolus is bland or septic. Bland means sterile. So whether it is sterile or whether it is infected. So whether it is bland means sterile, or whether it is septic means infected. So what is it? So whether it is solid or liquid or gas, bland or septic is the second classification. You got it? That is the second classification. The third classification, what is the source of arise of the embolus? Whether the embolus is present in artery, it is known as arterial embolus. If it is present in the vein, it is known as venous embolus. If it is present in heart, it is known as cardiac embolus. And if it is present in the lymphatics, it is known as lymphatic embolus. So these are the 4 types of embolus. You got it? These are the 4 types of emboli, right? Now, depending on the flow of the blood. The last classification, as I have told you, this is a blood vessel and this is a embolus. This is the embolus in the blood vessel. So normally, this is the flow of the blood. So normally embolus travel in the same direction in the flow of the blood. Rarely it can travel to opposite direction to the flow of the blood. Such embolus is known as paradoxical embolus. So a embolus is carried away from the, it is known as retrograde embolus, which is traveling against the flow of the blood. It is known as retrograde. One more terminology I would like to explain you. Okay, what is that? If the embolus is present in the artery or the embolus is present in the vein. If the embolus is present in the artery, it will remain in artery only. It will move from one artery to another, but it will remain in artery only. If the embolus is present in vein, it will remain in vein only. It will move from one vein to another, but it cannot move. Is there any way via which we can move the embolus from the artery to the vein or from vein to the artery? Is there any way? I'm asking to you. Is there any way we can do this? Yes or no? Yes or no? Yes, we can do that. We can do that via heart. So in the heart, let me show you a heart. There is foramen of ovule. Can you see this is interarterial septum? In the interarterial septum, or in the interventricular septum if there is a foramen, patent foramen oval. So the arterial thrombus can move to the venous side, or the venous thrombus can move to the arterial side. You can see, so this embolus is known as paradoxical embolus. So an embolus which is carried from the venous circulation to the arterial, or vice versa, from the arterial to venous, is known as paradoxical embolus. Give me a thumbs up. So what are the four ways? What are the four ways of classifying a embolus? Tell me the four ways, four classification of embolus. So first classification is depending on the matter. The second classification, whether it is infected, yes or no. So based on matter, it is of three types: solid, liquid, gas. Based on infected or not, it is of two types: bland, bland is non-infected, and septic, septic is infected, right? That is the second classification. Third classification is based on the source, where it is generated. Either it is generated in artery, or it is generated in vein, or it is generated in heart, or it is generated in lymphatic, right? That is the thing. The fourth is the special category of the embolus. So two special categories I taught you. One is paradoxical and other is retrograde. Retrograde, you should understand the meaning of these. Retrograde embolus is moving opposite to the flow, opposite to the flow of the blood. And paradoxical is the embolus which is either carried from artery to vein or from vein to artery via patent foramen oval. Please read the definition: via patent foramen oval. Patent foramen oval. Everyone give me a thumbs up. Have you got it? Have you got it? So we have studied the classification of the embolus till now. Classification of the embolus is also done. So we have seen the definition, we have seen the classification. Now in your syllabus, there are four embolus which you have to study in detail. So two are solid, which you have to study in detail. One is liquid, one is gas. So total four embolus you have to study in detail. The two solid one are thromboembolus and fat embolus. The thromboembolus and the fat embolus, these are the two embolus which you have to study in detail. The amniotic fluid embolus is the liquid embolus which you have to study in detail, and gas embolus is air embolus that you have to study in detail. Have you got it? So the two solid, one liquid, one gas, total four embolus are there in your detail. So the first one I am starting is thromboembolus. 90% time it's thromboembolus. It is the most common embolus. Rest all are only 10%. Right? So the most common embolus is a thromboembolus. So it is a detached thrombus. So once the thrombus got detached, it is thromboembolus. It is the most common type of embolus 90% time. So you can see the beautiful diagram. In the beautiful diagram, can you see a thrombus is there? This is a thrombus. Now it got detached and it got converted into embolus. This embolus is known as thromboembolus. Have you got it? It is known as thromboembolus. It is known as thromboembolus. Now for all embolus, okay, let me tell you one thing once for all embolus. Let me draw a embolus. This is the embolus. This is the embolus inside a blood vessel. Now this embolus can be a thromboembolus, it can be a fat embolus, this can be an amniotic fluid embolus, this can be an air embolus, whatever embolus it is. Now there are two things which I want to teach you in all embolus in common. What is that? Whether the embolus is present in artery, what will be the consequence? If the embolus is present in the vein, what is the consequence? Who will tell me? Any embolus. I'm not specific for any one embolus, any embolus. Whether solid, liquid, gas, amniotic fluid, air, thrombo, fat, whatever embolus. If it is present in artery, what will be the fate? And if it is present in the vein, what is the fate? What is the fate? Tell me the consequence or the fate of the arterial or venous embolus. Common sense. If it is present in artery, it will cause ischemia of the organ. It will cause ischemia of the organ, infarction of the organ, necrosis of the organ, gangrene of the organ, because the artery supplying less blood to the organ. So there is an organ, it is receiving less blood because of obstruction by the embolus, any embolus. So if the organ is brain, the person will have stroke. If the organ is heart, the person will have MI. So ischemia, infarction, necrosis, gangrene, stroke, MI, these are the results of arterial thrombus. I guess everyone got it. It is very easy. Let me come on venous thrombus, which is more difficult to understand. What if the thrombus is present in vein? What if the thrombus present in the vein? I will come on that, right? If the thrombus present in artery, any thrombus present in the artery, any thrombus present in the artery, it will result in infarction, ischemia, it will result in gangrene, necrosis, it can result in coronary embolism, MI, it can result in stroke, sudden death. So that is arterial embolus, right? You can see the embolus is present in the artery and it is causing less blood to that organ. This is the organ. So organ is receiving less blood because the embolus is present in the artery. It's okay. Okay, we got it. What about vein? Vein. If the thrombus is present in vein, can you see? This is the leg vein. Can you see a leg vein? Leg vein. Most commonly, the thrombus is created in leg vein. So first, a thrombus is formed in the leg vein, and then it got detached. After detaching, it is forming an embolus. So it is the thrombus in vein. It is the embolus in vein. Vein. Where it will go? What it will do and where it will go? It will go. All veins कहाँ पे जाती हैं? सारी की सारी veins. This is the organ. Everyone see, this is the organ. Okay, this one is an organ. All organ veins. Let me draw a thrombus inside it. All organs. So this is a thrombus. Thrombus detach and form the embolism. So veins go in superior inferior vena cava. Right or not? Just a second. Give me a minute. All the veins go in superior inferior vena cava. So the embolus is moving to superior inferior vena cava. From superior inferior vena cava, it is going to the right side of the heart. First, it is going in right auricle and then it is going in right ventricle. From the right ventricle, the embolus is moving to pulmonary artery. From pulmonary artery, the venous embolus is moving to the lungs. In the lungs, it is causing pulmonary embolism. So all venous embolism, which is present in any vein of the body, any organ vein, it will ultimately reach the lung and cause pulmonary embolism. So all venous embolism has only one fate, that is pulmonary embolism. In the pulmonary embolism, person will suddenly have dyspnea and person can die. It can be the emergency. You got my point? That is what is the route. So what is the route? So from the vein, the embolus, can you see from the vein? This is the vein. From the vein, the embolus is moving to the right side of the heart and there it is moving to the lung. So it is moving to the lung. So can you see from the vein, it is moving via heart to the lung, to the lung. So it is moving to the lung and causing respiratory distress to the person. So pulmonary thromboembolism is the most common and fatal form of venous embolism. So what is the summary? The summary is that if the embolus is present in artery or it is present in vein. What is the summary? If it is present in artery, it can result in ischemia, infarction, gangrene, necrosis. If it is present in vein, it always results in pulmonary embolism. Pulmonary embolism, which can be the emergency. It is only one fate. Vein is having only one fate, that is pulmonary embolism. Give me a thumbs up if you got it. So person will have sudden pain. The person will have sudden pain in the chest and respiratory distress in pulmonary embolism. Give me a thumbs up. Everyone give me a thumbs up. Most commonly, the vein which is involved is leg vein. You can see a leg vein. Inside the leg vein, this is the embolus. First, a thrombus is formed and it got detached and formed the embolus. Give me a thumbs up. So it most commonly occurs in the leg vein. It most commonly occurs in the leg vein. This is the route as I have already told you. So in the leg vein, first thrombus is formed. Thrombus got detached. It results in embolus formation, thromboembolus. Thromboembolus, all veins go in superior vena cava or inferior vena cava. From the superior inferior vena cava, it goes to the right auricle. From right auricle to right ventricle. From right ventricle to pulmonary artery, and it will result in pulmonary embolism. So all venous embolus result in pulmonary embolism. That is my point of teaching here. Again and again, I am showing you the same thing. So can you see this is a pulmonary artery? Please appreciate this is a pulmonary artery. Pulmonary artery got bifurcated into right and left. So you can see it here. This is the main pulmonary artery. The main pulmonary artery is bifurcated. This is right and this is left. So it is bifurcated. So this is the thrombus. This is the embolus. So embolus take the shape of the bifurcation. So it is a big embolus which takes the shape of the bifurcation. This embolus is known as saddle. Saddle. The shape is like a saddle. It is known as saddle embolus. The shape of the bifurcation, it is saddle embolus. Have you got it? So what are the consequences of pulmonary embolism? Either the person will have sudden death, either it is acute cor pulmonale, it is pulmonary infarction, resolution or hemorrhage, right? So I would like to stop now. So I have covered thrombosis and embolism in detail, right? So thank you very much for being with me. I really enjoyed teaching you and hopefully same from your side also. In the next lecture, I'm going to cover the congestion, CVC of three organs, right? If you like the lecture, don't forget to click on the like button, share with your friends, colleagues, all the medicos. Don't forget to subscribe our YouTube channel, that is Future Doctors and Let's Crack NEET PG of an Academy. Don't forget to click on the bell icon for the further notification. If you take the subscription, an academy is offering few new offerings to you. Now on the app, previous year questions are available for practice. If you take the subscription, there is an exclusive doubt solving batch is also available. You can ask your doubts to your favorite educators, and after every plus batch, there is a practice test for 5 to 10 questions, right? So these are the new offerings which we are providing to the subscribers, right? Unacademy Lite is available. If you want to take only test series of the Unacademy Live is already available. Subject wise, system wise tests are available. Now the biggest announcement is that if you take the subscription today is the last date, before 12 a.m. midnight today, last day, today is the last day, instead of 10% discount, you will get 20% discount if you apply my code on any of the subscription. My code is Sachdev10. SACHDEV, Sachdev10 is the code. Apply this code before payment. Instead of 10% discount, get 20% discount on Plus and Iconic subscription on all plans. So thank you very much for being with me. Once you take the subscription, you will be eligible for all these batches by the topmost educators of the India. Thank you very much. My next lecture, after few minutes, 15 minutes, I'm taking a lecture on congestion, right? If you take the Plus subscription, you will get access to Unacademy only. If you take Iconic subscription along with Unacademy, we will give you access to PrepReader also. Thank you very much for being with me. I'm ending this lecture.